All right. Good morning, everyone. Welcome to our Monday Next Gen Nurses free webinar series. My name is Jennifer Bonner. I am the manager of nursing services here at Archer Review, and I am so excited to be joining you today. So, any of you getting ready for a holiday break? Maybe you are at the end of your semester. Maybe you are just getting a break for a little bit. Let me know in the webinar chat how many of you are looking forward to a break. Good morning, Rose. Good morning, Chioma. How many of you are looking forward to a break? So we are getting down to the wire. We're getting a couple weeks off, maybe a week or so. Most of you probably have a couple weeks or more, but we are down to the last little bit. And so today I wanted to help you just kind of level up your readiness. So today we're going to talk about not only the Rapid 30, but we're also going to talk about some tips and tricks along the way. So if you've never met me, my name is Jennifer Bonner. I'm the manager of nursing services here at Archer Review. And I absolutely love my job. I know a lot of you are looking forward to a job that you love, and this is one that I absolutely enjoy getting up and going to work every day. So, a little bit about me. I am a nurse. First of all, I've been a nurse for over 16 years. I went back to school to become a family nurse practitioner. During that process, I realized I loved women's health. Went back to become a certified nurse midwife. Finished up my doctorate shortly thereafter. Practiced at the bedside for as a nurse midwife for about 4 years before I transitioned into education. I've been with Archer for almost 3 years now, and so this is the delight of my Monday morning is getting to be with all of you. So during our time together, I'm hoping that you're going to be interactive. I want to hear your answers, kind of your thought processes. And so if you are answering one of my questions, I want you to go ahead and put those answers into the webinar chat. If you have a question that you need answered by myself, please go ahead and put that into the Q&A, and I will do my best to get through all of those as we go. So, without further ado, the very first thing that I want to do is figure out what's going on at Archer Review this week. So, we're going to start by going to our nursing page. My computer's being a little bit slow this morning. We're going to go to our nursing page. Uh-oh. Here we go. Let's restart that. There we go. So we're going to go up here to nursing. We're going to choose RN. And then we're going to scroll down to see what is up today. Oops. There we go. All right, let's go ahead and see what we have going on this week. So, you are already here. You're at our Rapid 30, but starting today, tonight at 7 p.m. Central Time, Lauren Korth will be starting our pharmacology crash course. If you are interested in still joining that, there is absolutely still time. I'm going to put that link for you into the chat so you have that. And I will also put it in our Facebook and YouTube as well. So if you need that, go ahead, check that out. There's still room. It is 10 hours of review on pharmacology. You won't want to miss it. You'll have tips and tricks along the way. And it is a $75 value. So, or a $75 purchase. You also get those recordings as well. So that's what's going on this week. Let's go ahead and head on over to our tutoring page to see what private tutoring sessions and small groups we have available. So we're going to go up to NCLEX and we're going to scroll down. So today we have the mock NCLEX starting at 10 a.m. That's Mountain Standard Time with Lauren Korth. Tomorrow, the 16th, we have a couple private tutoring sessions available with Emma. We have a 2-hour NCLEX review with Lauren. Wednesday, we have some one-to-ones available. If you're looking for private tutoring, we have both 30-minute, which are $40, and 60-minute, which are 75 with our amazing tutors. So that's what's going on at Archer Review this morning. So someone is asking when the live lectures will be posted. The live lectures, if you're attending those, like there will be one tomorrow, those are usually posted within a couple hours of that session being finished. Okay. All right. Well, let's go ahead and talk about what we have going on. So, I have 5 tips for the end of your semester. So, 5 tips before you go. My first one is plan for success. What does that look like? Well, that looks like getting your notebook ready to go, figuring out what's on the docket, what's due, when is it due, when should you start it, or when should you have started it, and what else is going on. So, we know that in those last few weeks of nursing school, there are times when you're still finishing up clinicals, you're still having a few tests that are left over. Maybe you are having a few other things that you have going on, or you're preparing for the next semester already. And so, what I would encourage you to do is keep a list of what's going on. I'm a list maker. Y'all, if you could see my little checklist right in front of me, I make little boxes just so I can cross them out or scratch them out just so I feel like I have accomplished something. And so, plan for success. Know what's due, know when it's due, and then prioritize those. So, obviously, if I have something coming up tomorrow, that's going to be on the top of the priority list compared to something that's due on Friday. The other thing is have your things ready to go. So when you're sitting down to study, have all the things you're going to need and plan for distraction free. So this thing right here, it is kind of a lifeline, right? It's how I communicate with my teammates. It's how I hear about my family. It's how I get those emergency calls. If you are someone that needs it for those things, then please go ahead, put it on vibrate. That way, if there's something that comes over, you can get it right away. My other recommendation is only add those people that you would be willing to talk to or that you should be talking to. So for me, that might be my spouse, might be my kid's school, things like that, things that are going to be really important that would be worth being interrupted for. Otherwise, if you don't need it, go ahead and turn it off and just turn it over so you're not distracted by it. Have your textbooks, your computer. Maybe you need a warm beverage to help you study. Have all of those things in one place, and that will help you be successful. All right, so without further ado, let's go ahead and jump in to our rapid 30. So what we're going to do here is we're going to head on over to our QBank. I'm going to go to my QBank here for SurePass Combo, and I am going to create a test. So I'm going to do mixed. We're going to do all areas, and I'm going to use all of my questions. And let's see if we can get through. We'll plan for 7 here. All right, we're going to select all. Now, of course, if you're working on something in particular, you can definitely use these little boxes to narrow down that subject matter. But for our purposes, we're going to go through everything and all of it. So I'm going to select from all of these. And again, if you wanted to narrow things down a little bit more, you certainly could. And we're going to go ahead and load our test. All right, here we go. The charge nurse is planning a client care assignment for registered nurse and LPN. Which of the following clients would be most appropriate to assign to the RN? A client with chronic anemia, resolving pneumo, tracheostomy, or septic shock. What do you think? And I see your comment. If you are someone that is feeling like you're forgetting everything, I would consider just taking some deep breaths and remembering what you do know, because you do know this information. You didn't get this far without knowing that. And then if you're still struggling, go back to that anatomy and physiology. See if you can explain the why, and that will help you as well. Okay, I'm seeing some great answers coming in already. You can go ahead and put those into the webinar chat for me. Okay. So when we're looking at this type of question, it's really important that we not only understand our role, what our scope of practice is, but also the scope of practice of those who we could be delegating to. Those are also important. So, chronic anemia, that is a key word there. We know that our LPNs can take care of those chronic clients, right? So I like that it's chronic because I can delegate that out. So I'm going to go ahead and eliminate letter A. Letter B. So we know our clients should be assigned to those who are stable. They have a predictable outcome. So that chronic anemia is appropriate for an LPN. Resolving pneumothorax with a chest tube. Hmm. So that one can go to an LPN because that condition is resolving, right? They're kind of on the tail end of that. A tracheostomy that requires intermittent suctioning is definitely an option for an LPN. And so we are left with septic shock IV vasopressors. So, a client that is in septic shock, do we expect them to be stable or unstable? Let me know in the webinar chat. What do we think? Yeah, I'm thinking unstable. They probably don't have a predictable outcome, do they? Okay. The client with septic shock, that with the IV vasopressors, that one needs to go to an RN because those vasopressors are going to be needing to be titrated, right? So let's go ahead and see how we did. Awesome. We got that one. And if you notice down here on the bottom, we have those videos that will lead you right to talking about that information. And then we have our breakdown of our scope of practice. So we know that RNs, out of these two, the LPN and the UAP, has the most responsibility here. The LPN is kind of the go-between. So they are able to do everything the UAP can do, but not as much as the RN. And then the UAP is responsible for range of motion, helping our clients with their ADLs, eyes and O's, vital signs, that type of thing. Well done. Well, let's go back to see what tip number two is. So, tip number two is prepare for what you can. We know that there are things that are always going to come up that we are not ready for. Y'all, this morning I got up and my car didn't start. I was not prepared for that, but we can prepare for what we can. So, maybe that means picking out your clothes the night before. Maybe that means making sure that there's someone to take your kids to school so that you're not running late for your final exam. Maybe that means having somebody that has offered to cook dinner. So that's one less thing that you have to worry about. In my home, I try to look around and see, hey, who could use an extra meal? So for instance, this weekend, I was preparing a meal for a family who was going through a really tough time, and I went ahead and made two because I was already working on it. I had all of the ingredients to make two meals. So whether that's one to share or maybe one to put away for yourself on those nights where things are a bit chaotic and you have other things going on, prepare for what you can. So maybe go ahead and make two meals when you can. Or don't forget to ask for help. Maybe you need somebody to drive you. Maybe you can start a carpool. But when we prepare for what we can, the other things are just going to happen. And there's times when we can't prepare. We can't do anything about that car accident that's happened on the highway that takes us right to the school, and there's no other way around it. We can't prepare for the morning when we get up and our toilet's overflowing. Those are things we can't prepare for. But we can prepare for time management. We can take care of the time that we could be studying or we should be studying. Okay, so do what you can to prepare. So let's go ahead and check out our next question here. Oh, we have a little bit of a case study here. We're in the ER caring for a 42-year-old that's reporting flank pain. A 42-year-old male endorsing right-sided flank pain, nausea, vomiting, dysuria, increased urinary frequency, and hematuria. Symptoms started 12 hours ago and have worsened. The client reports the pain as a 9 on a scale of 0 to 10, states that pain is further exacerbated with urination, described as sharp and throbbing. He says he currently ran out of prescribed medications because he lost his job. Medical history of major depressive disorder, gout, hypertension, and hyperlipidemia. So before we jump into this question, are there any key red flags that you're noticing here that make you go, something is not right. I should pay attention to this. What's in there that you are seeing some red flags already? Okay, so I hear someone saying flank pain, right-sided flank pain, dysuria, vomiting, nausea, urinary frequency, hematuria. That pain, a 9 out of 10. It's sharp and throbbing. Okay. So we're starting to see those key red flags that are making us go, what could be going on here? Well, let's go ahead and check out our vital signs. What do you expect we're going to see with this client? We're expecting some elevated vitals here, probably a heart rate and a blood pressure. Let's go ahead and check it out. So we have a temp of 98, heart rate of 113. You're right, tachycardic. Respirations are 22, blood pressure 139 over 89, and a pulse oximetry of 96. Anything we're concerned about here? So we don't have a fever. We are a bit tachypnic, a bit tachycardic. What do we think could be going on here? Okay, so which of these client findings, and we're choosing two, require immediate follow-up? So we should only have two answers here. So how many of you think the oral temp of 98 is appropriate or something that we should be choosing? Okay, so many of you are throwing in your right answers. So let's go ahead and eliminate what we can. So the things that are normal typically are not going to be things that need an immediate follow-up. So what can we eliminate? The oral temp. So our oral temp is normal, so I can go ahead and eliminate that. Okay? Ran out of his prescriptions. Maybe some follow-up, but not immediate. That pain level is a 9 out of 10. I'm concerned about that, right? And that dysuria. So with the pain level being so severe, it's a 9 on a scale of 0 to 10, coupled with the fact of where it's located. So it's that right-sided flank pain. It has that symptoms of nausea and vomiting going on. I'm concerned, right? And then what about that dysuria? So that's the primary symptom our client has, right? And it says that it aggravates. The pain is further exacerbated with urination, described as sharp and throbbing. So I'm concerned about that. Blood pressure, it's a little up there, but not terrible. Recent job loss, that might be something to be concerned about, but not right now. And that medical history. Now, medical history is significant, has major depressive disorder, gout, hypertension, hyperlipidemia, but our main concerns are that pain level and that dysuria. So let's go ahead and look at our next question here. All right, so for each finding, specify if the finding is consistent with the disease process of cystitis or nephrolithiasis. Each finding may support more than one disease process. All right, so what do we think we have going on? Dysuria, cystitis, nephrolithiasis, or both? Okay, many of you are saying both. What about flank pain, cystitis, nephrolithiasis, or both? Ooh, I'm seeing some varying answers here. Okay, I'm seeing nephro, seeing that more frequently. What about increased urinary frequency? Okay, I'm seeing a lot of, let's see, seeing a lot of both. Nausea and vomiting. What do we think for nausea and vomiting? Okay, both. Okay, so let's talk about this one. So when it comes to dysuria, we see that with both cystitis and nephrolithiasis, right? Flank pain is more of a kidney issue, right? Nephrolithiasis, increased urinary frequency. We see that with both, and nausea, vomiting. Frequently, we see that in nephrolithiasis because of that severe pain, that visceral stimulation are big ones. So let's go ahead on to our next question. But before, let's go ahead and check out our third tip. So manage your fatigue like it's a clinical checkup. And what I mean by that is you are probably really exhausted by everything that's going on right now. We're at the end of the semester. There is a lot happening. There's time crunches, and you're going to be exhausted. So manage your fatigue. Figure out what you can do to make sure that you're getting enough sleep, you're getting enough to eat, you're getting those nutrients that your body needs, but also that you're taking care of yourself. Okay, so you're getting in some exercise if you can, getting outside, seeing your family, taking care of your mental health as well. And then again, paired with those other things. So preparing for what you can and planning all are going to help you. So let's go ahead and jump back into our question here. So we are back. We're prioritizing their care, determining that the client is at highest risk for which condition. What do we think this client has going on? What do we think this client has going on here? Okay, many of you are saying nephrolithiasis. Got three more questions. Here we go. We're prioritizing emergency care for our client. The priority nursing intervention for this client is what? What do we need to do for this client? What is the priority? Top of the list: drain the urine, initiate prescribed antibiotics, administer pain control, or obtain a urine specimen. What do we think? What is our main concern if we think this client? Okay. So many of you are actually saying pain control. Okay. Let's go ahead and move on to our next question. So we are going to specify, we're looking at the physician's orders, we're preparing the client for the ordered CT scan. Without contrast, specify whether the nursing action regarding their preparation for the CT scan is indicated or not. Review their medication list. Well, first of all, let's go ahead and check out the nursing or the orders we have. So we have IM ketorolac, we have a CT scan, we're getting a UA, we're getting some fluids, we're getting some on Dancitron. So review their medication list to see if they are taking metformin. What do you think? Is that something that's indicated or not indicated? Indicated or not indicated? Okay, many of you are saying no. Determine if the client has a pacemaker, implantable ports, or clips. Okay, many of you are saying no. Provide the prescribed pain control before the scan. We're going back to that previous question we looked at. And someone was asking earlier if an LPN can suction. Yes, they can. Okay, so many of you are saying yes. Instruct the client that they will have to lay still during the scan, indicated or not. And remember, if you're answering these questions, please go ahead and put them in the webinar chat for us so we can leave that Q&A box open for those who have questions they need answered so they don't get lost. Okay. Many of you are saying indicated. All right. So let's go ahead and look at our next tip before you go. Finish like the professional you are. Now, that can mean a lot of different things. That can mean doing your best up until the end. Even if time is a crunch, do the very best with what you have and what you can. So maybe that looks like, hey, you know what? I'm not going to have time to totally finish this, but the part that I can, I'm going to give it my best. That means turning things in on time if you absolutely can. That means being honest with yourself about what you can and can't do. That may mean having conversations with your instructors about your struggles, what you can do to finish well. Having those conversations now will set you up for success later on. All right, let's head back, finish up our case study. We have one more question. So we have our physician's orders and our nurse's notes. The client reports no pain, nausea, or vomiting, stating, I feel so much better. CT scan results showed a 2 millimeter stone in the right kidney. Dr. T. Smith gave a verbal order to discharge the client home and followed up with primary healthcare provider within 1 week. Discharge teaching provided. So I should increase my fluid intake. Effective or not effective? Which would indicate that the teaching was effective. Absolutely. We want them to increase those fluids when they have a kidney stone. I should avoid fluids that contain caffeine. And we're not going to be able to get to every question here. So if you have further ones, please don't hesitate. Reach out to us at nursing@archerpulse.com. We're happy to help. Okay, effective. Yes, because that caffeine, why do we want them to avoid that? We want them to decrease that caffeine because it's a bladder irritant, right? I should expect to develop fever and chills until I pass the stone. We hope not. That would be a bad situation. And I should strain my urine and bring the stone to my follow-up appointment. What do you think? Yes, we want them to strain their urine. We want to see, maybe we can send it away to see what it was. And we are absolutely correct. And that leaves us with our final tip, which is set your time off goals. I know that you're looking forward to it. So set off some goals. What are you hoping to do? Maybe still engage with some of that information, see family that misses you, and celebrate a job well finished. Thank you guys so much for joining me today. I hope you have an amazing end of your semester. Enjoy your time off, and we can't wait to see you back next year for our next Gen Nurses free webinar series. Take care, everyone. Have a wonderful day.